So, welcome to the show, Dr. Aditi.
Thank you for inviting me to my own show. So you are saying you've not finished it yet?
No, I have not finished it yet, but I have some questions for you, and we're gonna discuss those questions today. After eating something like milk, or let's say banana, or mosambi, or santra, and sometimes mango, they develop a rash, or sometimes they feel itchy. Is this allergy or is this something else? If a pregnant woman or a new mother wants to prevent allergies in their kids, so what to do?
Do not disregard allergies at all because you think it's just a simple runny nose or a simple rash. It can turn deadly. Having a joint family, having a large family helps the child prevent allergy. A lot of patients also do come to me with this whole panel of 100 and 150 allergens in their blood allergy testing report. And even in dust, a lot of people have this myth again that dust is because of that construction dust that is happening next to my house. If he is going to die with 10 grams of peanuts, with immunotherapy, he will die with 100 grams of peanuts, not with 10 grams.
Hello and welcome to the new episode of our podcast, Aditi Shah Talks, the show where we discuss daily health related issues, one conversation at a time. I am your host, Dr. Praveen Tavre, and I know you are surprised to see me as your host today. I have one more surprise for you. Today, we have our guest, Dr. Aditi Shah, whom I trust both personally and professionally. So, you know your daily host, Dr. Aditi Shah, who is certified allergy specialist and pulmonologist. So, welcome to the show, Dr. Aditi.
Thank you for inviting me to my own show.
So let's start, Aditi. So I was going through your book, which is Breaking the Allergy Curse, and I have some.
So you are saying you've not finished it yet?
No, I have not finished it yet, but I have some questions for you, and we're gonna discuss those questions today.
Sure.
There are some myths and there are some facts about allergies in common people. Like often after eating something like milk, or let's say banana or mosambi or santra, and sometimes mango, they develop a rash, or sometimes they feel itchy. So is that true? Is this allergy or is this something else?
So what happens is these foods, like especially the sour ones like oranges, mangoes, etc., they are highly histaminergic. Now by histaminergic, what I mean is they are rich in a chemical, in the itch chemical called histamine. They have high content of this itch chemical, and that is why they become a little itchy. It doesn't necessarily mean that they are allergic. You also mentioned dairy. Now, what happens is a lot of times after consumption of dairy, after 1 or 2 days, they get diarrhea or abdominal cramps, and then they label themselves as allergic to milk. But this wrong labeling is something that we need to stop, because essentially this is intolerance. By lactose intolerance, what I mean is that they primarily have gastrointestinal symptoms, stomach issues.
Okay.
They do not get skin rashes or they do not get breathless. But in an allergy, in case it was actually a dairy allergy, they would get symptoms within 2 to 3 hours of consumption. That doesn't happen in lactose intolerance. In lactose intolerance, there's just an enzyme deficiency that is not able to break down the lactose component of dairy, because of which they get stomach issues. And it's restricted to only abdominal symptoms. But in allergy, within 3 hours, they will become itchy or they become breathless. And that's what defines allergy.
Okay, so you want to say this food intolerance and food allergy are different things,
yes,
right?
Completely different, because allergy is a body's hyper immune response to a protein substance present in the food. And it's very specific, very consistent. Every time you have dairy, you should be getting that reaction in case you're allergic. Whereas in intolerance, the reaction is not consistent. It might happen sometimes, it doesn't happen sometimes. Sometimes you require large quantities to give a particular reaction. But in allergy, even a tiny spoonful of dairy will give you a reaction.
Okay. So, who are the people who are at high risk of developing all these allergies, Aditi?
So, Dr. Praveen, that internationally speaking, India has one of the least number of cases of allergy. India and Greece, and even Israel. These three countries, somehow the entire world is wondering why allergy cases are so less. And the answer is actually hidden in our cultural roots, the way we have been brought up by our forefathers, by our ancestors, the cultural traditions of India have always prevented allergies in us. Allergies are most commonly found in an urbanized setup where there is a lot of industrialization, lot of urbanization that has taken place. So with time now, in India also, when all of this, we are getting into westernization so much that allergies are slowly increasing. Earlier in the medical wards, we hardly had a few kids in the pediatric wards who had a nebulization machine on them. But now we see half the ward is filled with small kids with a nebulization machine. So there's one theory called the hygiene hypothesis, which means that children who have grown up in a very, very clean environment, typically found in cities where the houses are super clean, kept by their mothers, thinking that they don't want to give any kind of infection to their child. They don't even let the child play in mud. Those are the kids who are very prone to getting allergies. Why? Because if you're not exposed to germs right from birth, you are never going to stimulate your immune system. The immune system will not get activated enough. And that is what leads to allergies later in life. That is one reason. Another reason is, of course, when the parents themselves are affected with allergies. In fact, if one of the parents is affected with allergies and the kid has a 25% chance of getting that allergy, and if both the parents are allergic, then the kid has a 50% chance, which is pretty high.
Okay, that means allergies can be genetic as well.
Of course, yes. Hereditary component plays a huge role in allergies. And having a smoker, if the child has a smoking father in the house, that also makes them prone to allergies. So talking about pollution, cities where pollution is quite high, the kids obviously are going to develop allergies because pollution is one of the main causes. And finally, those kids who have had a history of severe viral pneumonias, the kind of pneumonias that require hospitalization in their childhood, they are at risk of developing childhood asthma or asthma later in life also.
This leads to a next question. If a pregnant woman or a new mother wants to prevent allergies in their kids, so what to do? Like, how can you prevent allergies in kids?
Preventing allergies is possible actually. And when a mother is expecting her child, when she is antenatal before delivering, we must ensure that the mother is in a pollution free or a lesser polluted area. Studies have shown that mothers who live right on the highway, where the truck density is very high, because of which the diesel exhaust on that road is very high, and if the mother inhales that, then her unborn child can have a very high risk of developing asthma.
Okay.
So that is one, staying away from highly polluted areas, factory areas and highway areas. Second is obviously the mother shouldn't be smoking or be around a smoker. She should avoid that completely. And third is that a mother, especially in the last few months of her pregnancy, should avoid any kind of stress. The reason why in Indian culture, women are sent to their maternal homes is so that the stress from the mother-in-law actually decreases, and that actually helps the baby, because the cortisol levels, the stress hormone, plays a very important role in developing allergies. If that goes high, then the immune system gets a kind of an imbalance which can trigger allergies. So that's why it's important that she stays with her own parents and kind of calms down. So that is one thing. And when the baby is born, studies have shown that if the child before 1 year of age is brought up along with dogs, that reduces the risk of allergies. Not cats, but dogs. Dogs somehow, their saliva, their body sheds certain germs, certain proteins, which stimulates the baby in a way that allergies can be prevented. And another way of preventing allergies is to give your child as much possible outdoor time. By outdoor, I don't mean you send him in a tuition class or a hobby class which is within four walls. No, that is not outdoors. Outdoors properly means under the open sky, in contact with mud or grass, being in nature. So the more you give outdoor time to your child, the more they will be in contact with things which can cause allergy later in life. But if you give them that exposure early in life, then their immune system recognizes these things as normal and doesn't give a hyperactive immune response like allergy. So very important to be outdoors more than being indoors, because most of these allergies are present, actually they start developing indoors only. Majority of the allergies, they are triggered because of the indoor allergens that are there inside our houses.
So you mean let them play outside, let them go to garden, let them go to
let them roll in mud. I mean, what is the big deal? Let them get dirty. That is so important.
Right.
Even having a joint family, having a large family helps the child prevent allergies. The reason why in India allergies were less, because we had such large joint families, because the child gets cross infections from the other sibling.
Right.
They share the same toys. They put it in their mouth, that the other one will also put it in the mouth, or they will share some upper respiratory infection that they have, or some parasitic infection will get transferred from one to the other. These small infections that we get in childhood from each other, no, they actually stimulate the immune system beautifully and prevent allergies. So having siblings, having other children in the house makes a difference.
Yeah, it's a blessing.
Yeah, it's a blessing. Of course, I have mentioned many other small details in my book. So it'll actually help new mothers on how to prevent allergies.
Yes. So this leads to the next question, Aditi. So what are common myths in our society about allergies? Like what you see commonly in your clinics?
There are a ton of myths surrounding allergies. One of the most common ones is regarding asthma actually. They think that after taking inhalers, etc., patient is feeling fine, child is fine. So his asthma is gone, but that's not so. Once an asthmatic, always an asthmatic. If your asthma has regressed, it has subsided, it is still there dormant in your body, that inflammation persists throughout life. That child, if not now, in teenage life or in adult life, will again have a bout of asthma later in life. So never think that the asthma has got completely cured if it happened in childhood. So that is one myth. And second myth is about inhalers in asthma. People think that inhalers or pumps are very addictive. आदत लग जाएगी, इस पे तो डिपेंडेंस हो जाएगा. ऐसा कुछ नहीं होता है, वो सिर्फ हिंदी मूवी में दिखाया जाता है. अस्थमा इनफैक्ट चालू होता है एक सिंपल खांसी से जो बहुत लंबे समय तक चालू रहती है. Chronic cough is one of the first symptoms of asthma. Patient doesn't necessarily have to be breathless like how they show in the movies. Right. No, they just come with a very long period of cough. Another common myth is that allergies are okay to live with. You can just live with allergies. It's fine. It's a normal thing. But no, you do not have to live with allergies. There are so many new treatments now available for allergies that can actually improve the quality of life to a great extent. And do not disregard allergies at all, because you think it's just a simple runny nose or a simple rash. It can turn deadly. Allergies, if you go and see in the US, they actually kill people. In India, we are fortunate that we don't have so many severe allergy cases. But in the coming years, when the cases are increasing, allergies are extremely deadly. They can cause a life-threatening reaction called anaphylaxis,
right,
wherein you are not able to breathe at all and your body swells up into a rash and you die within seconds. So do not underestimate allergies.
So a lot of patients come to doctor and ask about blood tests. So are there any blood tests for allergy and should we go for it?
Okay, another great question. A lot of patients also do come to me with, this whole panel of 100 and 150 allergens in their blood allergy testing report, and they are confused. They confuse the doctor also because 10 to 20 things are positive and they are already avoiding it. So that is completely wrong.
Okay.
First thing is that the ideal test for allergy testing is actually a skin allergy test. An allergy skin test is where small drops are applied on your skin and then they're lightly scratched. There's no blood removal and a reaction is seen immediately within 20 minutes. For food allergies, of course, there's something known as the oral challenge test wherein we give you a tiny amount of food in your mouth and observe you.
Okay.
So that is another gold standard. But when these people are getting these blood allergy tests, which are so expensive and, a lot of times you don't require these many allergens, they get confused because a lot of highly false positive reports come. By false positive, I mean that they'll be positive to cabbage, dairy, nuts, celery, etc. But the patient is actually eating them and not getting any reaction.
Okay.
So it doesn't correlate, right? It doesn't make sense. The patient is actually not allergic to all those things that have come positive on that test. So then what is the point of that test?
So they should.
You're paying so much. So these tests are done only in certain situations where we cannot do allergy skin testing. And they do not correlate with what the patient
Actual
actually
allergy
has. So
Right.
yeah, I strongly discourage people from getting these blood allergy tests done.
So you mean we should stick to skin prick testing and go to your allergy and ask for appropriate allergy testing like a skin prick test.
Yes, absolutely.
Okay. So this we spoke about grossly about other allergies, but what is difficult to treat allergy?
There are some allergies which are extremely difficult to treat even for an allergist. One of them is fungal allergies. They are a tough nut to crack. Fungal allergies often do require surgery also along with other treatments, and it's a very stubborn allergen, fungus.
Okay.
It somehow finds its way back. Okay, so that is one. And another is cat allergy. Cat is a very strong allergen. Even if the cat is removed from the house, for 6 months from that cat's removal, those allergens will still persist in the house because that allergen is so sticky that it remains in that place. Very difficult to remove it. So that is another allergy which is slightly difficult to treat. And there's cockroach allergy, very common in India. In fact, most people with dust allergy do have cockroach allergy. And cockroach is one thing where, Indians are so used to just killing like this. Killing that is absolutely wrong. Physically kill the cockroach,
Cockroaches.
always use pest control. And that's the only way of treating cockroach allergies, unfortunately. We do not have good therapies for cockroach allergy except for pest control. So that is another thing.
So we spoke about difficult to treat allergies. You told cockroach allergy or cat dander allergy, and one of those is fungal allergy. We see different allergies more commonly. So what are those more commonly seen allergies in India?
Yeah, so India is slightly different from the West. In the West, we get more of pollen allergies and more of food allergies. But in India, we get mostly dust allergies and cockroach allergies. So dust allergy is the most common allergy found in India. And even in dust, a lot of people have this myth again that dust is because of that construction dust that is happening next to my house or because I live on a very dusty road. That's not true. The dust allergy doesn't come from the construction dust or the outdoor dust. No, it comes from inside the
Indoor
house,
dust, yeah.
from your mattress. The dust mite, the tiny insect which you can't even see, only a microscope can see, lives inside your mattress, and not just your mattress, on every person's mattress. And the poop of that insect is what gets inhaled and causes allergies to sensitive people. Of course, not everybody, but it's the insect called dust mite,
Mite.
which causes allergies, dust allergies.
Okay. So what are different treatment options available to cure allergies, and is it really curable? And what can drastically change the quality of life of patients if you treat them properly?
See, allergies are not like some malaria infection that, you finish this 10-day course and you'll get rid of allergies. No, it doesn't work that way. Because allergy is something that is happening at the immune system level, at a very tiny level inside your body, and you cannot change that overnight. It takes years to get your immune system back into balance. Allergies have different modalities now available, one of them being immunotherapy. Allergen immunotherapy, especially for dust and pollen allergies, works wonders. It's almost a cure. It's the closest thing available to a cure because 60% of the people go off medicines once they take this immunotherapy. Of course, it's a long-term commitment. It's a 3 to 4 year long course, but it has greatly helped, especially the younger the patient, the better are the results seen with immunotherapy.
But what is this immunotherapy?
Basically, we give drops which are placed under the tongue of the exact same allergen that you are allergic to, so that your immune system starts recognizing it as something that is normal, not something that is an enemy to you.
Okay.
So you have to teach your immune system ki Baba, start adjusting with this thing.
So is it like desensitizing these patients?
Yeah, so it is. We are desensitizing these individuals. Now this is just a 3 to 4 year long course for dust and pollen allergy, but for food allergies, it's a lifelong treatment.
Okay.
Food allergies are different from dust pollen allergies in a way that they can cause death. Peanut or that dairy food which is giving allergy, he shouldn't die with that accidental dose. If he is going to die with 10 grams of peanuts, with immunotherapy, he will die with 100 grams of peanut, not with 10 grams.
Okay.
So we want to just safeguard that child with immunotherapy for food allergies.
Okay. So other than immunotherapy, do we have other treatments?
Yes, of course. For severe allergies, we have biologicals. These are some injections which are sometimes given along with immunotherapy, which greatly improve the quality of life, especially for severe asthmatics, for people with severe nasal allergies, and severe food allergies also. We do combine immunotherapy with biologicals.
A lot of times we see allergic patients do take different medicines like cetirizine, levocetirizine, montelukast throughout their life. So is it really safe, or should we give them better options?
Yeah, so even I have seen that, from the family physicians, they have just been on cetirizine, montelukast all their lives, and they're looking for other treatment options because they're very frustrated. Like, how long can you keep on taking these oral medicines? So in certain scenarios, people do need to take, but we have better options. As I just mentioned, biologicals. They're an excellent option for those who are frustrated with their rash. It works wonders. I mean, the requirement for medicine does come down greatly and gives an amazing quality of life to such people, who refuse to or are irritated with taking these oral medicines.
So, Aditi, many times kids come with nasal symptoms, common cold, runny nose. So, how the mother should understand, is this allergy or is this just an infection, and they should go to allergist?
So, the thing is that when a child gets recurrent cold and cough, but if it is associated with fever, it's not allergy, it's an infection. But if there is no fever, it's just a runny nose, or the baby is sniffing again and again, nose is always blocked, or there's some whistling sound coming from the chest, then that is an early sign of allergy, probably allergic asthma. Also, if these symptoms are restricted to certain seasons only, like the mother says that, only in the winters or only in the summers or when the season changes, that time the child starts getting these symptoms. So that is one of the indicators for allergy.
You mean if the symptoms are recurrent and persistent, then you can think of allergies.
Not persistent, but having a kind of a seasonal variation.
Okay.
That does indicate allergy. Allergy is more of a nocturnal disease. So the child usually has these symptoms during the evening hours or at the night, especially
Okay.
the whistling sound coming from the chest. That happens more at night in asthma, especially. Also, if the child is just rubbing his nose all the time like this, and child is having dark circles because of poor sleep, uh, because of the blocked nose, that those are also physical signs of having allergies.
So these are just nasal allergies or
So
allergies.
nasal allergies are one of the predisposing factors for developing asthma. Around 40% of the kids with nasal allergies go on to develop asthma. So it's very important to control the nasal allergies so that asthma can be prevented, and vice versa. Kids with asthma go on to develop nasal allergies.
Okay.
They're quite interconnected because our lungs and the nose are interconnected.
Right.
So allergy is a very progressive disease. It progresses from one organ to the other, progresses from your gut in terms of food allergies to the skin in terms of eczema or urticaria, which are itchy rashes. And then from there, they can develop nasal allergies, and from nasal allergies towards asthma.
Okay.
So that's how the pattern goes, or it can be in any other direction also.
Okay. So you mean there are different types of allergy like nasal allergy, skin allergy?
Definitely. Even the eyes get involved.
Eyes.
It's called allergic conjunctivitis, where the kid is just rubbing his eyes because he's exposed to that allergen, and rubbing their eyes can actually harm the cornea. So we always advise to avoid rubbing the eyes, get him to an ophthalmologist or an allergy specialist so that their itching can be controlled.
That's a wrap for today's episode. Thank you, Aditi, for sharing your expertise and insights about allergy and how to prevent allergy. I learned a lot and I hope you did it. I'm sure you will learn more about allergies from this book called Breaking the Allergy Curse, written by Dr. Aditi Shah.
So I hope I helped you guys dealing with allergies through this podcast. If you have any questions, you can mention them in the comment section. I'll be happy to help you out. And do like, share, and subscribe to my channel. We really need your help. It's still a young channel. So please do like, share, subscribe. Thank you.